Hello and welcome. My name is Jody Lounsbury. This presentation will define comprehensive medication management, or CMM, and introduce you to important concepts that will be covered in more detail in subsequent presentations. Upon completion of this presentation, you should be able to describe the importance of comprehensive medication management, or CMM, define CMM, and list the core components of CMM. Why is CMM important? 60% of American adults have at least one chronic condition, and 42% have multiple chronic conditions. 68% of Americans take at least one prescription medication a month, 52% take 2 or more per month, and 21% are on 5 or more prescription medications at any time. Prescription drug spending in the U.S. exceeds $300 billion annually and is on the rise. Individuals with multiple chronic conditions face numerous complexities in managing their medications. A contributor to poor quality care and rising healthcare costs is the overuse, underuse, and misuse of medications, and this has a concerning impact on patients. CMM has the opportunity to effectively address this misuse, underuse, and overuse of medications to meet cost and quality benchmarks and improve patient care. In addition, because of CMM's focus on optimizing medication use, its integration into patient care may also help primary care providers, specialists, and other members of the healthcare team meet the quadruple aims of improving population health, improving the patient experience of care, reducing the per capita cost of healthcare, and improving the provider experience. What is comprehensive medication management? The Patient-Centered Primary Care Collaborative defines CMM as the standard of care that ensures each patient's medications, whether they are prescription, non-prescription, alternative, traditional, vitamins, or nutritional supplements, are individually assessed to determine that each medication is appropriate for the patient, effective for the medical condition, safe given the comorbidities and other medications being taken, and able to be taken by the patient as intended. CMM includes an individualized care plan that achieves the intended goals of therapy with appropriate follow-up to determine actual patient outcomes. This all occurs because the patient understands, agrees with, and actively participates in the treatment regimen. Comprehensive medication management is framed around 3 core components of care: a shared philosophy of practice, the patient care process, and practice management. I will briefly cover each of these components on the next few slides. However, there are more detailed presentations on them within this learning module. The core tenets of the philosophy of practice include meeting a societal need, assuming responsibility for optimizing medication use, embracing a patient-centered approach, caring through an ongoing patient-pharmacist relationship, and working as a collaborative member of the healthcare team. CMM involves a specific patient care process, including 5 essential functions: the collection of necessary subjective and objective information about the patient, assessment of the information collected to identify medication therapy problems, development of an individualized evidence-based care plan in collaboration with other healthcare professionals and the patient or caregiver, implementation of the care plan in collaboration with the healthcare team and the patient or caregiver, and follow-up, which is monitoring and evaluating the effectiveness of the care plan to optimize medication use and improve care. The third component of care is practice management. Practice management is defined as all the necessary resources and support to provide CMM in an efficient and productive manner. There are 5 domains of practice management, which include organizational support, care team engagement, care delivery processes, CMM program evaluation, and ensuring consistent and quality care. Here are a few resources to introduce you to CMM.